Well, good morning. Thank you all for joining us. We're excited today to announce our budget targets for our GOP House budget for the next biennium. Our budget focuses on three main key priorities. Number one, making an investment in road and bridge infrastructure. Number two, in education. And number three, in reducing the cost of health care for Minnesotans. We also are focusing on meaningful, long overdue tax relief for Minnesota families. And we know how hard they work to generate our state's significant budget surplus, and for that reason, our budget represents a $1.35 billion tax cut that will go back into the pockets of Minnesota families. And of course, we want to make sure that we keep our government spending in check. So obviously, our proposal is the lowest spending increase out of the ones that you've seen so far. So with that, I'll turn it over to Representative Peppin.
Thanks for being here today. As you can see, our budget puts Minnesota families first. That's been our priority. We want to respect taxpayers, but yet we want to invest in key priorities. Those priorities are providing middle-class tax cuts, improving our roads and bridges, strengthening schools, and lowering health care costs. We're calling this the Minnesota way, which means identifying and funding priorities, just like families do in their own budgets every day in Minnesota. We're very proud of it, and with that, I will turn it over to our great chair of the Ways and Means Committee.
Well, thanks, Joyce. You know, when we look at the Minnesota way of budgeting, we do things the same way that families do things across Minnesota. We say, well, you know, how much money did we spend last year? How much money are we looking at spending this year? So when you look at kind of our main budget areas, how much money did we spend in the last budget, 2016-17? In education, roughly $17.4 billion. We're proposing to go up $1.1 billion to $18.5 billion. In health and human services, you can see that we're going up just shy of $2 billion, $1.959 billion. A lot of that is driven by the medical assistance program, but there are other needs here too that we believe we'll be able to accommodate with this budget. Higher education, we're going up $138 million. Public safety, $104 million, although it's really a little bit more than that because there's some deficiency spending in public safety that is in the 2017 budget that we will be doing as well. Transportation, we have a major increase here where we will be roughly doubling the amount of general fund spending that's going into transportation. And in fact, if you look at the road and bridge component of that, it's going to be somewhat up to the committee, but we're believing it will be something in the neighborhood of $450 million more in road and bridge funding, general fund road and bridge funding in our transportation area. Taxes, the tax aids, you know, local government aid, things like that, property tax refunds are going up a little bit, agriculture up a small bit, and the other committees are going down, although this number is a bit of a misnomer because within that $509 million is the $328 million of premium relief that we passed as part of the 2017 budget earlier this year. And so to be, you know, completely fair, you probably in a way need to subtract that out. But overall, we have a budget that we think meets the needs of Minnesotans. We're trying to bend down the growth of government. It may still look like government is growing a lot, and it's still growing, but not nearly as much as proposed by the governor. We're going to be, something in the neighborhood of well over $1 billion less in spending than the governor proposes. And we feel that that's what we need to do in order to have a sustainable budget for the state. With that, I think we can take questions.
We're going to be enacted. What would be the total spending for the next 2 years under your plan?
It would be just under $45 billion, 44.9 some billion dollars.
The governor's budget relied on some drawdown of the healthcare access fund for human services spending. Does your budget do that too?
No, we're not doing anything with the drawdown of the healthcare access fund like the governor did.
So looks like the Health and Human Services number is about $500 million less than the current trajectory. How do you get from here to there? Are you going to trim eligibility or change programs up?
Well, of course, that's really up to the committee on how they're going to get there. There's a lot of different ways to do it. Eligibility, which is something that we worked on a lot the last 2 years is, I think, something that will be likely part of that. In fact, to put it in perspective, I know the fiscal note that we had 2 years ago, which we thought was way less than it should have been, showed only $15 million in eligibility savings by implementing some of the reforms the legislative auditor wanted in 16 and 17, and $120 million in savings in this biennium. And so far, there's been no savings at all. They still really haven't implemented any of that. So there is, we believe, a lot of money in that eligibility area, but we do need to be bending down the cost curve and growth of some of these programs outside of that too.
Could you compare your numbers a little bit to the base numbers? It looks like education is only about 300,000 or something?
Yeah,
and
so education is up, a bit less than $300 million.
Okay. And then on HHS, it looks like there's a significant decrease from the base, about 400 million?
It's just on the difference is just under 600 million. It's 599 million. But again, that's where you have to look at what's going on in these budgets. Is even with that, HHS is going up more in total spending than any other area. Even with that, we're proposing to have it go up $2 billion. And frankly, when you look at some of the changes that are likely coming out of Washington, we need to be figuring out how to trim back the growth of some of these programs, given that we may have less money for some of them in 2 years than we have today.
So you're saying in HHS, essentially you'd be cutting from the base and then you expect Washington to be cutting from the base, and so there'd be significantly less money.
Well, Washington, we don't know what Washington's going to do, but from what we've seen so far, there's not going to be any appreciable cuts for this 2-year budget. It appears that what Washington's talking about, at least in terms of the Ryan bill that's been introduced, are things that would happen in the next 2-year budget. But we need to be trying to reform some of these programs now so that we're ready for that.
Mr. Speaker, the $1.35 billion figure for the tax cuts, are you going to be talking about income tax rate cuts, or is this more likely to be targeted credits and et cetera?
Well, we're probably not talking about income tax reductions. I think we'll look at things like helping seniors out with Social Security, middle-class families with different credits, the ag property tax credit that we had in the last biennium, things like that. So we're going to target our tax bill at middle-class Minnesotans, at seniors, at college students, at farmers, and at small businesses. We want to help small mom-and-pop businesses be successful here in Minnesota as well. So I would look for those kinds of things, but the tax committee will be working through that this week, so you'll see their bill probably soon.
Speaker, you say you're leaving this up to committees. How much input are you folks as leaders going to have on the final results here?
Well, I don't have a reputation of being a big micromanager. We really want our committee chairs to work out the details. Obviously, we've given them some guardrails here that they need to stay within, and but I think for the most part we agree on the approaches that are right for Minnesotans, and so I think you'll see us putting Minnesotans first.
Do they need to come to you before they pass a bill out of committee to get your blessing?
I've been meeting with the committee chairs regularly, and Representative Peppin and I and Chair Knoblach have been meeting with the committee chairs regularly, getting ideas on what they think the right approach is. So the targets are taking their opinions into account as well. We didn't just randomly set these numbers and then dictate to our committees that they need to stay within this guardrail. They were part of this process, so we've been working together towards these numbers.
And if I could, Don, to that point, we have kind of maybe a 3-step approval process in the caucus, and that the committee chairs go and they talk to the Speaker and Majority Leader and myself. They then go and talk to our executive board that's been elected by caucus members of 7 different people within the caucus who are sort of advisors to the Speaker to get their approval on the bill. They then take the bill to the caucus and we caucus the bill, and really only at that point are we ready to go with the bill.
So that the caucus will be before the committee votes, the caucus approval?
Caucus approval is generally been yes before the committee votes.
How soon will these start appearing on the floor?
That's a good question. I think probably the first week in April is when we'll start seeing them on the floor, if I remember right. So just prior to the Easter Passover break, you'll see them start getting posted, and you'll see them in committee this week.
Is there any money on the bottom line or left over for the reserves?
Yeah, we left about $200 million on the bottom line between the 18-19 and the 2021 budget. I'm glad you brought that up, because I guess I'd contrast that with the budget that Governor Dayton introduced in January. Had $84 million on the bottom line for 18 and 19, and $5 million on the bottom line for 20 and 21. So we have $200 million on the bottom line between those two biennium, and that's about double what the governor had in his budget that he came out with in January.
And what's the purpose? What's the purpose of leaving that much on the bottom line for you?
Well, I guess it's kind of a cushion for any other contingencies that might arise.
You were talking about guardrails. Talk a little bit about how you envision the transportation plan coming out. Where's the money coming from? Where's it going?
Obviously, we're using a large general fund component. There will be some savings within the transportation bill itself, but the committee's still working through that process, and they'll have a rollout and an announcement of their package probably in the coming week, so we'll let them fill in the details.
Do you anticipate dedicating specific revenue streams that are now general fund streams to the trunk highway fund or to other transportation purposes?
Yeah, I think you can assume that we're going to use, as I said, a significant general fund component to this. It's very difficult for us when we have record surpluses to say to Minnesotans to pay for something that's a basic core function of state government. We're going to raise your taxes again. So we're going to use the money that Minnesotans have already given us to pay for what they expect us to pay for, roads and bridges. So I would expect, and it's going to be north of $300 million coming out of the general fund. It likely will be the auto part sales tax, but we'll let them fill in the details on it.
The governor has, I think in a letter to you and in other settings, been fairly firm about not wanting an across-the-board, unspecified cut to state agency budgets. He wants everything laid out. Do you plan to lay it out, or are you guys on a collision course here?
No, we did not do an across-the-board cut to state agencies. I think that's an approach the Senate was talking about taking. I guess I don't know if they're actually doing that or not, but they had talked about a 5 or a 10% cut across the board to state agencies. That is not what we are doing. You'll see where our reductions are prescribed in our bill.
What areas of state agencies do you think are most ripe to meet this target?
I would just say that, Chair Anderson and that committee is going to work through the state gov. They're the most knowledgeable about that budget area serving on the committee, and they're going to be working through the process in their committee.
The governor was also quite firm about keeping policy provisions out of spending bills. What's your reaction to that?
Well, I guess my reaction would be, it's never been done before by either party, and I don't know why we would start now.
What size bonding bill does this accommodate?
This basically is what I guess I'd say a forecast bonding bill. It accommodates an $800 million bonding bill this year and an $800 million bonding bill in 2018. And that's something that we really haven't made a decision yet on what we're doing in regard to the bonding bill, and if we have one, how big it might be. And so as we put this together, it seemed like the most reasonable approach was to just go with what was in the forecast.
This time 2 years ago, your budget would have eliminated Minnesota Care. Do you see that happening again with this HHS target?
I guess I would say no. I mean, it is up to the committee, but with this HHS target, I don't think that we're going to be looking at doing that. I think one of the things, we've generally looked at is to say that with some of the uncertainty going on in the federal level, I don't know if it's a time to be making really big changes, whether that's getting rid of Minnesota Care or whether that's expanding Minnesota Care in a public option like the governor's talking about too. I think we need to see a little bit with what's going on at the federal level, and based on my discussions with Chair Dean, I don't believe that's going to be part of the plan.
Forgive me if I missed this. Can you talk about the interplay between tax relief on your sheet and taxes and aid on your sheet? Are the taxes and aid all local government aid and that kind of thing, and then the tax relief is to?
Yeah, the interplay is, taxes, the tax committee, it's not often known, is actually the third largest spending committee that we have. And you have not only local government aids and county aids, but you've got renters credits, you've got the property tax refund, you've got a host of other credits and aids that are going out there. And so our credits and aids continue to grow marginally. A lot of this is kind of prescribed by what's in law with regard to inflation, but we'll probably look at trying to trim back some of those a little bit. The political contribution refund, for example, is in this area. That's also counted as part of credits and aids. You know, that's a decision for the tax committee on what they're going to do on that. The $1,350 million tax cut is sort of outside of that taxes and aid discussion.
So are you saying trimming back some on LGA and other local aids?
No, I don't anticipate that we're going to be trimming back on LGA or other local aids.
And you all had mentioned that you're not going to be trimming back income tax. Why not? That was a major point of contention with the governor. Why not go after the fourth tier?
You know, I guess one of the things I know that Chair Davids has talked about in the past is that, you know, this has been a signature achievement from the governor's view of his budget some years ago. And I guess to say, put a fourth tier tax cut in the tax bill, which we're fairly confident he would just veto, I think sort of takes up other money that could otherwise be dedicated toward tax cuts that maybe he would like. And so that would be, at least speaking for myself, one of the concerns about doing that. But if you want to pop in on that.
And I would just remind everyone that last year, 89% of legislators voted for a tax bill, and we were very disappointed when the governor vetoed the tax bill. And so I think that you can look that we will put some of those same things in, and obviously with the fourth tier, that's something that the governor is not going to sign, and we want him to sign a tax bill this year.
And the tax bill of last year had significant cuts to tobacco taxes, cigarette taxes by deleting the...
No, it didn't have any cuts to cigarette taxes. It reduced future increases.
Funny how it showed up on spreadsheets as a cut.
But that's the problem. I know you've asked too about the base, and what would happen if we didn't do anything? If we didn't do our job and we just went home, would the base happen? No. Our constitutional requirement here is to set a state budget. We're going to do that through this process. So we need to be accurate. That's why we have simply given you this year's spending, our proposed spending in the future, and what the difference is. The base is a great planning tool and a guideline, but it has no constitutional power whatsoever. None. Zero. We have to pass that. So I think same thing with the cigarette tax. People love to say that we're reducing a cigarette tax. Absolutely not. We're simply taking away an automatic increase, which is a horrible policy. I think you'll likely see that we're going to do the same thing with the statewide business property tax. Taking away an automatic inflator in tax policy really gives up our right as legislators to set those policies ourselves.
But you are going to be taking away that automatic increase from cigarette tax.
We may, yeah. You may see that in the bill.
Yeah, I mean, I think that's, again, something that's up to the tax committee. But I do want to say something in regard to this whole discussion of base. I mean, I really think that looking at this sort of way, the Minnesota way that families do things, what did you spend last year, what are you looking at spending next year, is the way to do it. Because when you get into looking at this base funding, it's all dependent on what we've written into the law for how we treat certain of these agencies. So if you look at K-12 education, there we count the increased number of students and then automatically add to the base more money. But in higher ed, if those students are a little bit older, we don't do that. We don't do that at all. In public safety, we don't make almost any changes for looking at potential inflation, for example, whereas in health and human services, we do. And so it's really kind of confusing to look at the base, and I really think it's more accurate to look at the way things are looked at by most families. What did we spend last time? What are we going to spend now?
All right.
Thank you.